Hello, my name is Neelam Saini and I work as a community pharmacist at Cookham Pharmacy. I have been asked to produce a short video to help you understand the patient journey following an electronic referral into the Pharmacy First service. For the remainder of this video, I will refer to the Pharmacy First service as simply the service. The service is made up of three elements. The first being electronic referrals from the GP practice for minor illness consultations. The second being the clinical consultations pathway. This comprises of 7 conditions that both GP practices and the patients themselves can refer into or could be identified as such by the pharmacist team or pharmacist when the patient presents to a pharmacy. And thirdly, the urgent supply of repeat medicines, referrals for which are generated by patients themselves or through NHS 111. Electronic referrals are made via the EMIS Local Services button. Non-clinicians should use the Assess to Refer button to guide patients to the most appropriate NHS service. Electronic referrals are important because they transfer auditable clinical responsibility to the pharmacy. When you are referring a patient, please provide them with the pharmacy contact details and remember to tell the patient they should contact the community pharmacy by phone or in person to proceed with the consultation. Advise the patient they should explain there is a referral from the GP. If this is not highlighted by the patient, there could be a risk in the delay of recording the outcome of the consultation and hence a delay in getting that information across to the GP practice. The risk of this happening, however, is small as the platform and emails are being checked regularly. Depending on the workload at the time of the call from the patient, I may need to call them back within a reasonable period of time agreed with them. Or if the patient walks in, there may be a wait to consult with me. The platform we use to help us manage our services here at the pharmacy is Pharma Outcomes. My team and me are made aware of referrals on the platform either by an email notification to our regular branch email address or by checking the platform itself. Emails are checked regularly throughout the whole day to ensure no referrals get missed. If workload permits and there is freedom of time, I may make the initial contact with the patient. Pharma Outcomes has several layers of security before access to patient data, and these layers ensure that only those members of the pharmacy team that require the data to allow for the patient to be cared for have access to it, as stipulated by GDPR. Patients being referred by the GP practice will be listed on a services page from which a traffic light system helps highlight those consultations that require attention, and a record to be made to make the GP practice aware of the outcome of the consultation. Consultations are free and confidential. They can be conducted online, by person, or by phone. There are several clinical pathways that require a physical face-to-face contact with the patient to ascertain which treatment will be best suited to them. An example being a child with an earache. This requires an examination of the ear with an otoscope. I may carry out some of the consult over the phone or invite the patient in for a face-to-face consult at an agreed time. This all depends on the nature of the service that needs to be provided and also allows me to plan the consult around the other demands of the community pharmacy at that time. All referred consultations for the service take place in the consultation room to allow confidentiality and the patient peace of mind that their health condition is being taken care of seriously. During the consultation, I will ask about what symptoms the patient is experiencing, take their full medical history, explore their ideas, concerns and expectations to allow for a constructive consultation that results in the most appropriate advice and treatment options. Consultations are always patient-centered. For example, ensuring patients understand that antibiotics are not always supplied as it may not be the most appropriate treatment at that moment in time. All consultations will result in either advice on self-care, advising on purchasing an appropriate product over the counter, in the case of the clinical pathways, treatment supply within the protocol of a patient group direction referred to as a PGD, or onward referral via a secure message through the platform or by a locally agreed route to their healthcare provider. There are 7 clinically structured pathways, and servicing these pathways are 23 PGDs. These PGDs allow pharmacists to supply treatments regardless of their legal medical classification within a strict protocol from the NHS. PGDs are always signed off by a variety of healthcare professionals and have been used with confidence by pharmacists within community pharmacy over many years. Deviation from PGDs is not permitted. Should the patient health condition fall under one of those 7 clinical pathways, I work within the pathways and the PGDs that have been set to allow for a universal consult regardless of which pharmacy the patient visits. It is worth noting that any medicinal treatment supplied under the PGDs will be charged in line with patients' usual NHS prescription eligibility. Safety netting is also provided, that is, recognising worsening symptoms and what to do whilst either taking the medication recommended or afterwards, or when acting on self-care advice. Advice is always reinforced with the use of leaflets, signposting to useful websites. Patients that have used the Pharmacy First service find it user-friendly, convenient and easy to navigate. Promotion of the service, both locally and nationally, is helping increase our footfall of patients into community pharmacy, raising our professional profile and also raising awareness that we are indeed part of the NHS primary care team. We welcome this closer collaboration with general practice. This all in the hope that time is being freed up to allow our GPs to deal with more complicated cases that present to them daily. My hope is Pharmacy First will further be expanded into other health conditions as community pharmacy proves time and time again that we really can be part of the bigger picture and be part of the solution in the ever-changing, challenging landscape of the NHS. Thank you.